Welcome to Harvest Medicine's initial assessment video. As part of your health and wellness journey, we'll be covering important topics such as safe use, strains, the endocannabinoid system, cannabinoids, terpenes, methods of use, adverse effects, and your patient journey. Tips for safe use of cannabis include not driving after using THC and at least 4 hours after inhalation and 8 hours after ingesting THC. Never use cannabis while pregnant or breastfeeding. Don't stop other medications before consulting your doctor. Stick to your authorization and guidance, and also avoid certain medications as addressed by your cannabis doctor. Although cannabis has been proven beneficial for many ailments, it is not routinely prescribed for a handful of conditions due to some contraindicators. These conditions include psychosis, bipolar disorder, and patients with a history of heart and kidney issues. Lineage of the cannabis plant can be separated into three groups: indica, sativa, and hybrids. Indica effects are often described as calming, sedative feeling in the body, while sativas provide an energizing, uplifting feeling in the mind. Hybrids are created by crossbreeding both indicas and sativas. Make sure to check if your hybrid is indica or sativa dominant to get a better idea of its potential effects. The two types of cannabinoid receptors are called CB1 and CB2. Both are found throughout the body, but most are common in the brain and immune system. When cannabinoids activate these receptors, they change the way our body functions. CB1 receptors are responsible for psychoactive effects. They are present in many areas of the brain and play a role in memory, mood, sleep, appetite, and pain sensation. CB2 receptors are responsible for anti-inflammatory effects, and they are found in immune cells and work to reduce inflammation. The two main cannabinoids in cannabis are tetrahydrocannabinol, THC, or cannabidiol, CBD. CBD is non-impairing and produces anti-anxiety, anti-inflammatory, anti-seizure, and pain-relieving effects. THC, on the other hand, is impairing. While improving appetite, boosting mood, and relieving pain, it also works as a sleep aid. Terpenes are present in most plant life and give each strain of cannabis its particular medicinal and aromatic qualities. Patients will often try to match certain terpenes to their particular condition for maximum relief. For example, pinene is good for alertness and creativity, while linalool is good for sedation and anxiety relief. In order to activate these terpenes, set your vaporizer to the boiling point of a specific terpene in order to leverage its particular effects. The two primary methods of use are inhalation and ingestion. If choosing the inhalation route, we recommend vaporization over smoking to get the most out of your medicine, including better flavor, less carcinogens, and optimal efficacy. Expect a 1 to 3 minute onset followed by 1 to 3 hours of relief when inhaling cannabis. Patients can also choose to ingest cannabis oil orally, typically cooked in food or taken directly using an eyedropper or syringe. When ingesting cannabis, expect up to a 2-hour onset followed by 4 to 8 hours of relief. Always keep onset and duration in mind when choosing your method of use. And remember, start low and go slow. As with all medications, cannabis has a number of side effects that you may experience during use. The most common adverse effects reported by our patients include drowsiness, feeling faint or lightheaded, fatigue, headache, impaired memory, and disturbances in attention and concentration. Be sure to let your doctor know if you experience any of these effects during your follow-up appointment. When you arrive, please check in at reception. Feel free to explore the space as you wait for the doctor to call your name. You will then be called into the doctor's office for your medical consultation. Following your doctor's visit, you will meet with a CannaGenius educator to guide you through the registration and the licensed producer's shopping process. Remember to book your follow-up appointment with your CannaGenius before you leave.